Hello class, today we'll be discussing the healthcare reform, also known as the Affordable Care Act. How would you feel if you all of a sudden had a medical emergency, an illness, and you did not have adequate health insurance or no insurance at all? What would you do? Where would you begin? How would you decide? Now with the new law, the decisions have been made easier for you. An unexpected illness can happen to any one of us. Without adequate health insurance, it may make you drain your savings account. It may cause you high medical bills, which eventually lead to bankruptcy. People who do not have health insurance often skip medical care. They postpone getting care due to the cost because they just simply cannot afford it. They have trouble paying for the medical bills, and then collection agencies get involved, and that will also mess your credit score up. And nobody wants a phone call from a collection agency about a medical bill that was unexpected that you just simply cannot afford. People who do have health insurance get preventive care that prevents the illness. They get treatment earlier for the illness or the disease, and they have a better outcome with all the health problems because they were able to get the treatments done early in a more timely fashion. There's a simple process to help you with the Affordable Care Act. There's a streamlined applications. I personally work for the state of Maryland, who has their own state exchange. Some states do not have a state exchange, and that's when you would have to go to healthcare.gov, and that will have the streamlined application, which will help you to determine what your eligibilities will be based on your household family size. And coverage options that you get on the exchanges. You can be eligible for a qualified health plan. A qualified health plan is licensed through your state. My state is Maryland, so my plans would be licensed through the state of Maryland. And it also covers the essential health benefits, and it agrees to the same premiums and rates through the exchange that you would get through the exchange that you also would be able to get outside of the exchange. The health plans on the exchange must cover 10 essential health benefits. And the 10 essential health benefits are ambulatory patient services, emergency service, hospitalization, maternity and newborn care, mental health, substance abuse disorders, prescription drugs, rehabilitative and habilitative services, laboratory services, preventive and wellness services, chronic disease management, and pediatric services, including oral and vision care. All health plans must cover these 10 essential health benefits to help you feel better. My state has expanded Medicaid. Some states have not. Since my state has expanded Medicaid, the Medicaid income is based on your household size and income as well as for qualified health plans. But some people, based on the federal poverty level because of their income with their household size, has made them eligible for state health insurance. The state health insurance is usually free health insurance, and it also includes the 10 essential health benefits. So that's one less financial burden that you have to worry about. Financial help is available for any family who works. Even if you cannot afford the insurance, you are eligible for certain tax credits to help you subsidize the plan through the exchange. And that is something that is determined on your streamlined application when you go on your exchanges or the government websites to see what you're eligible for. These that are tax credits are advanced premium tax credits. The purpose of the advanced premium tax credits, as we know, when we file taxes, everybody gets a certain type of tax credit, but you have to wait for those tax credits when you file your taxes, and you get those in a form of a refund. The health insurance tax credits are advanced, meaning when you do your application, it's subsidized, you're eligible for certain tax credits, so you get those payments immediately. Those payments are sent directly to the insurance carriers that you pick on the exchange, and it helps to subsidize your plan. You have the option to take the whole tax credit, part of the tax credit, or none of the tax credit. If you opt to not take none of the tax credit, you will be responsible for the full price of the premium, which will make the premium basically unaffordable, but you will get a big tax refund at the end of the year. The eligibility for the premium tax credit is based on the family poverty level. The FPL is based on how much the government feels as though your household size and your household income plays according to whether you are in a poverty level or not and what percentage you are. These are the parameters based on the household poverty level for a household of 4. In a household of 4, you make less than $23,550 or $94,200. You are eligible for advanced premium tax credits, which will subsidize the loan. Some are also eligible for cost share reductions. Cost share reductions is what helps to lower the co-pays, make some of the plans not eligible for deductibles, and it also helps to make it more affordable. But for those families that are eligible for cost share reductions, you must be below 250. So then when you go on the application and do your plan, you may be eligible for both advanced premium tax credits and cost share reductions, or you just may be eligible for advanced premium tax credits with no cost share reduction. Again, as emphasized, it's based on your federal poverty level. Help when you need it is someone like myself. For myself, I work on a state of Maryland exchange. I am a healthcare navigator. I help to explain how the policies work, help you to figure out what your household income is and your tax size and how the income, and help you put your application onto the exchange to see what your subsidies will be or will not be. Also, insurance brokers are allowed to do this, but there are only certain licensed insurance brokers, and your local health departments and local department of social services will help you to find out what you may be eligible under the new Affordable Care Act plan. Insurance terms that you need to know, which where I come in play again, I help you to explain these plans to you and how they work. What a premium means, which is your monthly payment, your copay, what you pay when you go to the doctor for certain services. If you have a deductible on the plan, well, how that means co-insurance. Co-insurance is a very confusing term, but for most people, they know that that's balanced billing. Basically, you done paid your copay, you go to the doctor, the insurance company paid the doctor, and then he bills you later saying, oh, I didn't get enough money for this service, so you're responsible for the balanced billing, which is the proper term is co-insurance. Maximum out-of-pocket. Maximum out-of-pocket will come into play, which makes these plans more affordable because based on these plans, whether you have a 60-40 plan, a 70-30, 80-20, 90-10, they have a cap on what the maximum out-of-pocket is. Let's use a 70-30 for example. Most 70-30 plans based on your FPL level or based on the application, you have a $2,500 out-of-pocket max. How that comes into play is after you've met your premium, your co-insurance, and your deductibles and your co-payments, you go to the hospital, you get a bill. The insurance company pays 70%. You're responsible for 30%. Your 30% is over the $2,500. Then the insurance company will pay more than 70% and cuts your max off at $2,500. You're only obligated to pay the $2,500 if that is your maximum out-of-pocket expense on the plan that you've chosen on the exchange. These are some of the resources that I've used to do this project. Mine is geared mainly to the state of Maryland, but each one of you, if you wanted to do more information, more research, you can find this information on the health government website, thehealthcare.gov. You could go on there, pick your state. It will tell you whether your state has a local exchange or not, and it will give you all the references and information that you need that I have briefly explained to you in this topic. This subject is so vast that this would take even longer. So what I have also included was a Kaiser Family Foundation video on the ACA. It was a little cartoon. It's a YouTube link on here, and it's for the YouTunes, and they basically do a little cartoon to explain each principle of that I've already briefly explained to you. I hope that I was able to give you some information to give you a better understanding of the Affordable Care Act. Thank you and have a nice day.